Okay, welcome back. Today's webinar is on the BioFlex Personal Therapy Light system for treating ankle and foot conditions. My name is Dr. David Kanashko. I'm the Director of Education, Research and Training here at Meditech International, the manufacturers of BioFlex laser therapy devices. I'm a chiropractor by profession, also acupuncturist and traditional Chinese medical doctor trained. And I've been working with the team here at BioFlex for the last 10 years in the capacity as a clinician at our outpatient clinic here in the West End of Toronto, as well as I mentioned, being involved with education and training and research. I broadcast two different types of live webinars. One is the one today for use of the personal system. So this is geared for home use. And it's a little bit different with respect to how I actually present the material. It's designed not so much for the clinician in mind, but more for the general public that might be using our system for home use or thinking about using light therapy to treat different conditions at home. I also broadcast webinars for clinicians. Everyone's free to join in, whether you're a clinician or not. However, the information is a little bit more clinically based and designed more so for our professional equipment. So those are the differences really. All my webinars are recorded, and as long as you register for a webinar, even if you can't tune in to listen in that day or have to leave early, we edit the webinar and it's sent out in a separate email after the webinar, usually a few days later, and you have a link to watch it again on YouTube. If you'd like to watch it again, or you haven't had a chance to actually watch the original webinar. So keep that in mind. Register even if you can't listen in live, and you can actually watch it a little bit later on. I'm assuming everyone can hear me loud and clearly. I've asked everyone to let me know if they in fact can hear me. So apparently everything is good with respect to that. Okay, so the goal of today's webinar is to talk a bit about reviewing our personal therapy systems. I do this every webinar just so that I do have newcomers every session, so I want to make sure everyone understands the equipment and how to use it on a very basic level. Then I'll talk a bit about what photobiomodulation or low-level light therapy or low-level laser therapy, there's different terms for it, including photobiomodulation. I'll talk a bit about what it actually does in the human body. And then specifically, I'm going to talk a bit about some conditions in and around the ankle and the foot complex, as well as how to use the equipment to achieve optimal results. And I always do a brief safety concerns informational session as well. And then we'll have time at the end to do Q&A. I do actually recommend that you type in your questions as you come across them. That way I have them at the very end to go over as well. So BioFlex manufactures and sells two types of systems, the BioFlex 120 and the BioFlex 180 personal therapy systems. So these aren't professional grade. They're designed to be at home use. And there are some differences. Obviously, one is the size. The 120 has 120 diodes of light, and the P180 obviously would have 180 diodes, so greater surface area, an area that you're treating with the P180 compared to the P120. They're both effective, obviously, but depending on what you're treating a lot on your body or the size of your body, you may want a smaller one or you may want a larger one. And if you're not sure, you can always inquire and we can help guide you as well too. The diodes themselves are interesting. They're bicolor, so they emit two wavelengths of light. The first wavelength of light they emit is red, in the wavelength of around 660 nanometers, and then they will then automatically emit near infrared wavelengths at around 840 nanometers of wavelength. The controller unit itself has different buttons on it. Obviously, it corresponds to the anatomical locations that you're treating. Today, we're going over ankle and foot conditions, so those are the ones that we're most concerned with for today's webinar. At the very bottom, you can see there's a power button, a stop button, start and pause, and selecting a stage, all kind of self-explanatory. The stages are really have to do with how much light is being emitted and how quickly the pulses of light are being emitted as well. And I'll talk a little bit more about that at the end of today's webinar. To understand how photobiomodulation works is a somewhat lengthy procedure, but I will talk a bit about its effects on the human body. We know that prolonged use of red and near-infrared wavelengths stimulates circulation in a way that creates angiogenesis and neovascularization. So it actually improves blood supply by increasing the number of capillaries and branches of capillaries. We do this a lot for wound care, but it of course works for other conditions as well. It also has an impact on cells that produce and secrete collagen, and it increases its productivity and secretion and the maturation of collagen as well in the human body. When I say human body, it also works in all mammals as well. So if you have furry friends or not so furry friends, it also works on them as well. We also, the effects of light therapy work on muscle cells. So whether or not you're trying to regenerate or repair muscle cells, it can be beneficial for that. Light therapy is known to interact with circulating white blood cells that control inflammation. So it actually helps control and reduce pro-inflammatory chemicals, and it increases anti-inflammatory chemical secretion by white blood cells. And lastly, we know that this light can also have a profound effect on the ability of nerves to recover, so nerve regeneration and repair. It can help cartilage repair as well, whether it's in the meniscus in the knee or the hyaline cartilage at the ends of joints, for example, in your toes. And if you have a fracture, for example, that you can get at, this light can also be beneficial to help with bone formation as well. There's two ways that photobiomodulation works, or low-level laser therapy. One is directly, so if I have an injured cell, in this case a neuron, if I expose it to the correct wavelengths of light and the correct dosages and frequency, it can actually help those mitochondria that are impaired due to inflammation and metabolic stress become healthier. So direct stimulation of a cell where it absorbs the light will actually help these cells repair and recover. There's also a very profound effect systemically. We call this an indirect effect. And how this works essentially is that as that pad of light is being exposed to the circulation in the blood, of course in the blood there's white blood cells, and these white blood cells, when stimulated, as I mentioned earlier, actually help carry the effects of anti-inflammation as well as promoting increased white blood cells, circulating white blood cells and stem cells. And this will be carried deeper to the deeper structures and tissues in the body as well, and can help promote the healing of damaged cells, in this case, this example being a damaged nerve cell. So you don't necessarily have to get the light directly to the damaged tissue, but if you can, that's even better. But if you can't, because, for example, the problem lies very deep, or you don't have enough light on the surface of the skin, you still may get an indirect effect or systemic effect that can help that tissue heal, or at least help reduce pain and inflammation. So why do we use red and infrared light? Well, again, a complicated question, but really what we need to understand here is that red light is really beneficial. However, it doesn't penetrate very deeply, and that's because it is in part absorbed by a lot of photoacceptors in the human body, including hemoglobin, which is found in red blood cells, melanin, which is found in skin, and other types of photoacceptors. So it actually blocks red light from penetrating very deeply. It may only penetrate 3, 4, 5 millimeters, maybe a centimeter, but it doesn't go very deep. Whereas near-infrared light penetrates quite deeply compared to red light. It can penetrate several centimeters into the human body, depending on the type of tissue that we're talking about, whether it's fat, muscle, or bone. And it has a similar effect to red in that it can help spur and increase metabolism of the cell and help promote its regeneration and repair as well. So we use red and near-infrared light. Red is very good at treating superficial conditions and treating a lot of the blood that's circulating just deep to the skin, and the infrared going a little bit deeper into the deeper structures like muscle tissue and joints and bone. So the wavelengths that we use with BioFlex are 660 nanometers. That's one of the wavelengths, or in that range, that seems to be very stimulatory, as I mentioned. And we use near infrared around 830 to 840 nanometers, again, penetrating a little bit deeper into the human body, and also having a similar effect to red light. And again, I'm going to mention that if you have questions, please type them in. I'll get to those questions at the very end of the webinar. The longer we hold the light on the surface of the skin, the more light that can accumulate and be effective at a deeper level. So the idea behind longer treatment times when you're using our equipment is that it promotes the maximum absorption of light at the deepest point in the body. So when you see that it's asking you to place the light pad on your skin for 15 minutes or 18 minutes or whatever time frame, the idea there is that we're trying to target the deeper structures as best possible, and that takes a bit of time. So the shorter treatment times oftentimes isn't highly recommended because you don't get as much light penetrating deeper, and you don't have as much stimulation of the circulating blood as well. Okay, let's talk a bit about ankle pain. Very quick review on the bones of the ankle area. Of course, is the tibia, which is your shin bone, and the smaller fibula. And this will articulate with a bone called the talus and with the calcaneus, or your heel bone. So this complex in through here is really what I'm referring to as the ankle joint complex. You can see it's quite complex, obviously, and has a lot of joint surfaces. So when I talk about ankle pain, I'm talking about issues in and around these particular bones. Now, you can see that there's lots of different ligaments. In this case, we're looking on the inside of your ankle joint, and there's a very strong ligament that's called the deltoid ligament. This ligament can be sprained, although it's not the more common ligament to be sprained. That's on the outside of the ankle joint complex. But depending on how you sprain your ankle, this is one of the ligaments that can be most affected. On the outside of your ankle, which is called your lateral malleolus, or ankle bone, there's three ligaments: the calcaneofibular ligament, the anterior fibular ligament, and there's also a posterior talofibular ligament that's not shown here as well. These are the ligaments that tend to be most affected when you sprain your ankle, for example, and you turn your ankle inwards. So this is a very common area to treat with light therapy. Of course, there's lots of other structures around the ankle complex. There's quite a few tendons and tendon sheaths around that are kept in place by ligaments. I won't go into all their names and so forth, but you can see that especially on the outside of your ankle, there's quite a few tendons that wrap around your ankle bone in order to move all the different joints of your feet and your ankle. One of the most common causes of ankle pain or around the ankle are Achilles tendinopathy. I apologize for the poor resolution here. One of the most common side effects or symptoms is morning pain. You also might feel some stiffness and some swelling. If you squeeze your Achilles tendon, it might be warm or tender when you squeeze it. Oftentimes there's pain after exercise. Occasionally it might feel a little bit better after exercise and then feel worse afterwards. And if it's a chronic condition of the Achilles tendon, oftentimes you'll see thickening of the tendon compared to the opposite side. Bursitis is a very common condition at the ankle complex. So in the back of the heel bone, oftentimes you will see sort of bulging area of inflammation. Now, a bursa is a thin fluid-filled sac that's meant to decrease friction between moving parts. So in this case, there's actually bursa located between the heel bone or the calcaneus and the tendon, and between the tendon itself and the moving of the skin. So you can see here in this diagram, these two bursae, the retrocalcaneal bursa, which is between the tendon and the heel, and the subcutaneous calcaneal bursa between the skin and the calcaneus. So either of these can be affected. You'll see these a lot, more so in women, but men as well, just because of the type of footwear that sometimes women wear. But you will see a swelling on the outside portion here of the heel. Ankle sprains are a very, very common condition. Usually what happens is you turn over on your ankle on an uneven surface. Perhaps you're playing a sport and you land on someone's foot, something along that nature. You turn your ankle over, usually on the inside, and then you'll get immediate pain and swelling. The next day it will be black and blue, as shown here. And don't be surprised if you see swelling and blueness, or what we refer to as a hematoma, not just over the area that's been damaged, but the blood accumulation a little bit farther out towards the toes as well. That's a very common condition. Less common is sprains on the outside of your ankle as well. So the inversion sprain is the most common one that we see. However, if you evert your foot, which is turning on the inside, you may tear the deltoid ligament. So that's the swelling on the inside of the ankle complex. And another common, maybe not so common as the inversion sprain, is referred to as a high ankle sprain, where the ligaments a little bit higher up between the fibula and the tibia are also sprained. And this is one that's oftentimes misdiagnosed or missed. So if you have ankle pain that's a little bit higher up in the ankle complex, it may be a high ankle sprain. And I do recommend that everyone, if you do have an injury or a pain, you at least get it checked out and diagnosed properly so you know what to treat at home as well. A common pain scenario in the ankle is due to osteoarthritis. And this usually occurs at the weight-bearing portion of the joint between the tibia and the talus. You can see this diagram here showing you where you have degeneration. That's because it has so much weight bearing over the years, and it starts to degrade as we get a little bit older. So where do you position the array? Well, let me start off by, this is not a very good picture here. Let me just talk about bursitis. So when you're treating bursitis, you want to position the array so that the middle of the light pad wraps around the inferior portion of the tendon and the heel bone itself. So the actual bursa itself will be located in this generalized area. So you may need to shift that array so that's positioned appropriately, covering over that bursa that is affected. Remember that you can position the array and strap it into place by using the strap that's included with your kit, okay? For medial and lateral ankle sprains and arthritis, you want to apply the array in 3 positions. The first one is on the inside of the ankle. This diagram here doesn't show a great job of it. I actually want you to shift the array a little bit more forwards so it's wrapping nicely around the inside of the ankle bone. So it's not too high and not too low. It's sort of right around that bony bump and covering the area that's tender of that ankle sprain if it's on the inside of the ankle. And you also want to treat the outside of the ankle. Again, just shift that array so it's directly wrapped around the outside portion of the ankle bone. Now you want to treat this even if you have a sprain on the inside, because when you sprain the ankle joint, it affects the entire ankle joint, not just the side that you sprained it. That way you can actually more effectively treat the ankle joint itself. And lastly, I wanted you to treat the inferior portion or the bottom portion of the ankle, and you do this by wrapping around the heel bone. Again, you can strap it into position to keep it in place. So again, just to review, if you're treating a medial or inside ankle sprain or an outside ankle sprain, I want you to treat 3 positions: the inside of the ankle, the outside of the ankle, and the inferior or bottom portion of the ankle joint as well. Now, if you're treating a high ankle sprain, I want you to do similarly to what I showed you earlier, but I want you to shift the array so it's a little bit higher up where the ankle sprain itself occurs. So you want to shift this array so it's wrapping all the way around in 3 dimensions around that entire ankle joint. Depending on the size of your ankle, you may actually have to treat or use 3 placements. So on the inside, outside, and around the back of the ankle. And I want you to shift it up a little bit higher than the diagram that's being shown here, so you wrap it around that area of the high ankle sprain. If you're not quite sure of the location, just Google high ankle sprain and it will show you exactly the area affected, just in case you don't have a proper diagnosis. But I do encourage everyone to ensure that they see their healthcare practitioner and get an appropriate diagnosis. How long do you treat? Well, for the ankle, usually we place the array for about 14 minutes. So red comes out for 6 minutes, and then it automatically turns into 8 minutes of infrared. Remember that near infrared light you cannot see, so you don't know it's on, but you'll see the timer on the device actually counting down, so you know that it's emitting light. So for each spot, each location, it's about 14 minutes of light. So for example, if you're treating a ankle sprain, you're going to do 3 positions, so that's 3 times 14. So you can do the math on that. That's about, do the math on that, right? So that's over half an hour of treatment to treat the entire ankle joint complex. You'll get better results if you treat the entire ankle joint as opposed to just that one spot that you sprained. Let's talk a bit about foot pain. So the bones of the foot are a little bit distal or farther away from the ankle joint complex. You can see that the hind foot is where the ankle complex is, whereas the midfoot and forefoot is what we really consider to be foot issues. You can see there's a series of bones all labeled here on the right, and then of course you have the metatarsals and then the phalanges or the toes. Now, of course, there's lots of joints. There's lots of joints in the midfoot and the forefoot and the hindfoot. And you can see that there's the distal interphalangeal joints, the proximal interphalangeal joints. Sometimes they're shortened as dips and pips. And then, of course, you have the metatarsal phalangeal joints, and then all the joints in and around the midfoot, the tarsal metatarsal, navicular cuneiform joints, and the calcaneocuboid joints. Lots of muscles, intrinsic muscles of the foot, both in the bottom of the foot and the top of the foot. We don't need to get into the names and the locations of those muscles. And most importantly, for a lot of you that have plantar fasciitis, you should be aware that the plantar fascia connects from the bottom of the heel and fans out and connects into the tissue as you get towards closer to the metatarsals and the toes. And the idea of the plantar fascia is that it's a spring-like kind of tissue that gives you, forms the arch of your feet and allows you to have a spring to your step as you walk along. Common causes of foot pain include metatarsalgia, which is a generic term for pain and tenderness at the ball of the foot. And this occurs when the metatarsal heads become prominent and tender. Different causes for metatarsalgia. It's usually an inflammatory process due to overuse or poor mechanics of the foot. So I do recommend that you get your feet checked out for the mechanics, whether that's a good chiropractor. Well, I'm a chiropractor, so I'm going to recommend chiros, but of course, other practitioners from physiotherapists to podiatrists and other healthcare practitioners that deal with the feet. You can go to any one of those. They, of course, should be able to diagnose and treat you accordingly as well. Next condition, Morton's neuroma. I had an email this morning about a gentleman that was asking about the effectiveness of BioFlex and Morton's neuroma. Well, Morton's neuroma, first of all, is not really a neuroma. It's not a cancer kind of issue, but it's actually a degenerative condition. It's benign. It's growth in and around a nerve tissue that compresses it. Usually it's between the 3rd and 4th metatarsal heads of the metatarsals, but it can occur at other locations as well. And that's usually due to the collapse of the transverse arch of the foot. So Morton's neuroma itself is 5 times more common in females. I hate to say it, it's because of the footwear. It's compression of the interdigital nerve. There's a lot of information here, but essentially what happens is due to narrow toe box footwear, that's women of course, it could be due to hyperextension of the toes in high-heeled shoes. It could be due to deviation of the toes due to a genetic issue, inflammation of the bursa that are found in that area, thickening of ligaments, trauma, sporting activity. So lots of different causes of Morton's neuroma. And laser therapy can be very, very effective in helping with neuroma. However, you have to have these issues, these mechanical issues addressed as well. Otherwise, you're chasing the problem because the cause of the problem hasn't been looked at. Bunions, very common, unfortunately more common in women than men. And this has to do more so, not so much with their footwear, although that can contribute. Oftentimes it's hereditary. So women that have a bunion, oftentimes their mother or grandmother may also have had a bunion as well. But of course, flat feet or low arches, there could be other neuromuscular conditions or genetic issues as well that may contribute to the formation of a bony bump at the big toe. Arthritis in the forefoot, well, usually it's RA, rheumatoid arthritis, but you can get osteoarthritis as well in the little toes. A very common cause of arthritis in the big toe is gout. Gouty arthritis is caused. You may even see psoriatic arthritis as well. And osteoarthritis, probably a bit more common in the ankle joint complex, but may also occur in the foot as well. I mentioned about plantar fascia. Well, one of the most common conditions at the foot and it causes pain in the arch, especially on the inside of the arch, is plantar fasciitis. Other causes of heel pain in that area is a heel spur. Now, it's not so much that the spur is poking and causing pain. It's usually inflammation around that heel spur that's causing the pain itself. And of course, who hasn't smashed their foot on something that was put there by mistake, or perhaps you just forgot where your bed was and you smashed your foot on a steel bed frame or anything of that nature, and next thing you know, you have a fracture. And you go to the Emerge, and Emerge says, oh, yeah, you have a fracture, nothing we can do about it. Put on some ice pack, keep it elevated, and don't walk on it. Well, yeah, thanks. I could have told you that, or anyone else could have told you that, but you can use laser therapy. It's very effective to treat fractures, especially if it's not casted. So if the fracture is a small one and you're just in a walking cast, you can remove it and effectively treat it with a BioFlex laser therapy to really enhance the healing and accelerate the healing of the bone and reduce the inflammation and the pain. So where do you position the array? Well, for metatarsalgia, Mertens neuroma, I want you to do two placements. The placements are on top of the foot and on the bottom of the foot to ensure that you get all that area of the metatarsalgia or the neuroma that you're treating. For a bunion or gout over the big toe, I want you to wrap the array around so it makes contact with both the top and the bottom of the affected big toe or the large toe, or first toe as we call it. So you can use the attached strap to keep it in position to treat that area of the gout or the bunion. Arthritis of the toes, well, depending where the arthritis is located, it would be similar to treating a metatarsalgia or Morton's neuroma. You just might need to shift the array a little bit closer to the ends of the toes that are affected. And again, I want you to treat the top and the bottom of the toes. The more surface area that you treat, even if it's not directly on their arthritis, is beneficial because it does stimulate the white blood cells and that anti-inflammatory effect I mentioned earlier. So for plantar fasciitis, I want you to do two placements. One is so that's parallel, and it's shown in diagram A on the bottom of the foot. So on the inside of the arch, you can actually curve that array on the bottom of your foot. Maybe use a rolled up towel and place your foot on the array and then over that rolled up towel. What I don't want to see you do is to use a flat surface and apply it then, because number one, you might not make good contact, but number two is that anything hard, I want you to be careful not to step on these arrays or place it against anything too hard, because of course that's not really good for the array itself. And the second placement is to wrap around the heel bone. It just gives a little bit more energy and light in and around the insertion of the plantar fascia, especially on the inside of the foot, because that's usually where you get more of that pain and discomfort. For a fracture, I want you to place the array both on the top and the bottom of the fracture site. Of course, in this picture, I'm only showing you the top placement, but I also want you to place it on the bottom portion as well. Be careful not to apply too much pressure. So I don't want you necessarily to use that strap when you're treating a fracture, just because that area is going to be so sensitive. So gently place it over the fracture site, make sure you have good contact, and that should be good enough. How long are treatment times? Similar to the ankle, it's about 14 minutes per location. So depending on how many placements, you may just be treating for 14 minutes or 28 minutes or 42 minutes, depending on how many placements that you need to make. So how often should you be treating? If you have a fresh injury, so a fresh fracture or something that is very acute, I want you to treat at least 4 or 5 consecutive days in a row. I don't want you to treat more than once a day typically. And then after that, you can start to treat on alternate days, so maybe 3-4 times a week. And then as things are progressing nicely, you can go down to once or twice per week until you feel that you've had maximal recovery. Depending on the condition, you may want to perform what's referred to as maintenance treatments. So for osteoarthritis, or to sort of prevent the ongoing progression of rheumatoid arthritis, you can treat on an ongoing basis, maybe once a week, twice a week. You'll find out what seems to work best for you as you go along. These systems are designed to make direct contact with the skin. Make sure you don't use it over any clothing or bandages or materials that can block the light. Make sure you don't have any creams or lotions on your feet or the ankle before you treat as well, because that may block some of the light and may also get onto the array, and it may not be good for the array itself. Make sure there's good firm contact, unless of course I've mentioned otherwise in the case of a foot fracture. So make sure that you use a strap or whatever else you can use to keep it nicely in place and making good contact at the ankle or the foot. If you remember, you're going to allow the array to emit both red and infrared light. You want to make sure you use both those wavelengths before moving on to the next position. Try not to overlap the area too much when you're treating. A little bit of overlap is fine, but you don't want to treat the same area twice, obviously. Initially, I want you to start at treatment stage 1. Don't jump up stages too quickly. Don't start at stage 3 or 4. Start at stage 1 and see if this works. Apply at least 4 to 8 sessions or thereabouts using stage 1. And if you're getting a good response, keep it at stage 1. However, if you're not getting a great response or it's kind of plateauing, that's the time to go up to stage 2 and again repeat trying another 4 to 8 sessions and seeing if you need to adjust accordingly. So you'll just continue to do this and go back and forth. What I might recommend for maintenance treatment is use stages 1 to 2, not the higher treatment stages. These systems emit high intensity non-coherent light from what are referred to as superluminous diodes. They don't really pose a risk to your eyes, and obviously you're treating at the feet, so that shouldn't be an issue. And again, as I mentioned earlier, you might want to use a pillow or a rolled up towel if you're treating that array on the floor. Just put a pillow or the cushion or rolled up towel just to kind of protect that array. Photosensitive medication doesn't normally interact with the wavelengths that we use. It tends to interact more with ultraviolet light, so it's considered safe to use if you are taking a photosensitive medication. However, I always recommend that you check with your family doctor just to make sure that everything is good that way. Do not use it over actively bleeding tissues. If you have a cut or laceration, this can definitely help, but make sure that it's coagulated before you start to throw the light therapy on. Don't use it over any areas of known cancer, whether it's skin cancer or any other forms of cancer. We don't know the effects of light therapy, and obviously it's not wise to do that. I want to thank everyone for listening in today. I really appreciate you taking your time and effort to do that. So I do really appreciate that. Just to let you know that we do have a online certification course occurring on October the 16th. It's $199, a fairly reasonable price for an entire day of training. If you would like to join us, please register. Just go to bioflexlaser.com, go to events, and you can register. It's pretty straightforward to do that. So I think it's a great way to just get a little bit more information about photobiomodulation. Also, the next two webinars, a professional webinar coming up is laser therapy for sciatica. You're certainly welcome to join in and listen to that as well. Again, there's no cost for these, but if you do want to deposit some money in my bank account, I will put that at the very end of the webinar. Just kidding. And the next personal therapy system webinar is on October the 22nd, specifically for treating facial pain. So temporomandibular joint, post-dental pain, trigeminal neuralgia, those kinds of things. I'm going to be going over that on October the 22nd. My email, david@bioflexlaser.com. Contact phone numbers are here, and let me get to any questions that you may have. So I do have a question about application for my husband's metastatic prostate cancer. Is there any, I'm assuming, Phyllis, that you mean, can you use it, and the fact that your husband has metastatic prostate cancer. The issue here is that light therapy is contraindicated and should not be used over an area that you know there's cancer. So if it's metastasized, one has to be careful not to use it over a metastasized area. But if it's cancer-free in that area, then it should still be okay. But again, I would recommend conferring with the oncologist about that. Phyllis has mentioned she owns a laser probe. Doesn't really know how and when to use it. So Phyllis, I'm going to ask you to email me about that and just figure out what we can do to help you out with respect to that. A question from Dennis: is there a risk of overdose by treating too frequently? It's not so much there's an overdose, but if you treat too frequently, we find that it's not as effective because the body is being stimulated, and if it's overstimulated, it doesn't seem to be as effective. So if you're going to treat twice a day, treat in the morning and evening, and maybe that's only if it's really acute. Otherwise, we find the best results are doing it on a daily basis or every other day as things progress. A question by Carol. She has a cyst on the bottom of her foot, a thick kind of ganglion that cannot be drawn out with a needle. Can the home system be effective for that? And what about going in for appointments with a professional unit? Yeah, we have treated ganglion cysts, whether it's in the foot or the hands. It certainly it could be helpful. I think the laser probe might be a little bit more beneficial for the cyst. I'm not sure where you're located, Carol, but you could email me and we could figure that out, whether or not you need to come in for a session, or I can help you out using the personal system. But it may, in fact, be helpful for that. I do have a question from Helen. She has a bone spur as well as plantar fasciitis, and they've been using laser on it. How often and what level would be most effective? I think I covered that in the actual webinar, Helen. But if you have any further questions, you can actually email me. Because, when you're dealing with plantar fasciitis, it takes a long time to get better. And it depends on a few factors for that. As I mentioned, biomechanical factors. So Helen, maybe email me and I can help you out a little bit better with that. All of these webinars are recorded, and as long as you register, you can access them again via an email. However, if you want to access the webinars and all my archived webinars, we have a support page for that, but you have to have our equipment in order to access it. Question from Zara: would you treat pain on top of the midfoot with the same protocol? Is this likely from the tendon or ligament pull if no bone spur? So the rule of thumb here is that when we're treating pain or an issue, we want to wrap the array and treat around the entire circumference of the area that's affected. So whenever possible, I like to treat on the sides, the top, and the bottom of the condition that you're treating. For a high ankle sprain, question from Angela, could you treat with only 2 placements with the P180? As long as you completely treat the circumference of the high ankle sprain, that's correct. You could use 2 placements. It depends on the circumference of your ankle. Some people have big ankles, some people have thin ankles, so it just depends. Carol, do you have the treatment chart available as a PDF? I'm not sure what you mean, Carol. If you're with respect to the treatment times, that kind of thing, I'm not sure, but give me an email. I can see if I can help you out. I have a question from Steve. I was shown a screen that I had previously seen. I'm not sure what that question is, sorry. For ankle arthritis, question from Bob. How many treatments are required to obtain relief? If this is a lifelong treatment, or does it cure arthritis? Okay, so no cure for arthritis, Bob. I wish there were, but there is none. The idea behind using photobiomodulation for arthritis is to modulate the inflammation, reduce the inflammation in a way that doesn't have any side effects like medication. And to some degree, it can help slow the progression down of arthritis. But no, obviously, there's no cure for arthritis, regardless of what you read or hear about. There's only things that can help manage it. But it can help manage arthritis in quite an effective way. Question from Phyllis. Due to rheumatoid arthritis, I have severe metatarsalgia. And I think I covered metatarsalgia. Diabetic neuropathy, it can be very helpful for that as well. It cannot treat laser cannot help with fungal toe infections. For that, you need to use a higher powered laser. Question from Angela. Could you demonstrate the Velcro strap? Sorry, I don't have a webcam set up, but you can always email me and I can figure that out with you. Can you use this system to treat on hip fractures? Yes, you can, even with a metal plate. That's not a contraindication. You can go ahead and do that. I have a heel bone growth likely due to pressure and rubbing, ski boot related. Yeah, it should definitely help that as well. How do you clean the SLDs to not damage the LEDs? We do recommend that you use a antiseptic wipe, not a domestic brand, but a medical grade wipe that doesn't have any like perfumes or smelly things in it. So that should be fine for cleaning the array. Then a question about a patient that has leukopenia. Okay, Francine, that's quite a complicated question, and I appreciate the question, but I just don't have the time to answer it. Can you email me? Okay, that's it. Thanks very much for joining, everyone. I appreciate it, and hopefully we'll see you next time. Take care. Bye.